Okay, well, welcome everybody to this webinar. Um, I'd like to say kind of a few words before we get going, and sort of place that within the context of the work of the coalition. I think the last 6 months has seen us really embark on a new area, which is the financing of the post-2015 development agenda, and I think that embarking really who's this? It really began with the meeting in Mexico, where for the first time I think many members of the coalition learned about the work that was taking place under the GFF that was at that point in time under development or just getting started. I think it was that meeting that led a lot of people to recognize and realize that our role and our work is profoundly shaped by decisions that were being taken at that point in time and that would be taken in the months to come, and yet really we were pretty much out of the loop in terms of those discussions. I think a lot of us, are really not involved in those discussions, relatively high-level discussions. I think sometimes the language that comes from high-level financing is not the language we speak within the commodity space. But at the same time, we recognize, that this is so critically important to what we do. And so that really launched our engagement together with partners within FE 2020 and other within the advocacy community to really begin to monitor what was going on in the GFF, set up the GFF advisory group that launched a series of weekly calls, and that eventually led to the publication of Connecting the Dots, where we're trying to reach out to the community at large, get them information about what's going on or what was going on in the development of the GFF, but also let it serve as a vehicle to shape what was going on within that. And I think what we learned is that a lot of the issues that were coming out of GFF really were very much in line with many of the broader discussions that were taking place in connection with the larger architecture of financing for development, and the feeling was, I think, on the part of many within the coalition broadly, is that we need to know what's going on. We need to be able to make sense of what's taking place. We need to understand what the implications of the new financing architecture, or at least what was under development that would shape the new financing architecture, meant for us in the supplies arena. And so we commissioned the study that we will be hearing about right now, really to get a better sense of what the dialogue is, but also to help guide us in reaching out to the community. The other piece that's important, I think, to keep in mind is that subsequent to this activity here, and the award under our Innovation Fund to support this work is an award that we issued as well to IPPF that will be using much of the material from this as part of sort of wider outreach and wider advocacy to really move this agenda forward and make sure our voices are heard. Make sure that the supplies community, family planning community, broader reproductive health community does get their voice heard as the new architecture gets developed. I think probably most of the people on this call are familiar with the authors of this study, but just in case, I'd like to introduce them. The really principal investigator and the lead on this project is Karen Haines, who has a master's degree in public sector financial management and social policy. She has 27 years experience researching, analyzing, and influencing donor policies and financing. She has more than 10 years experience within the field of SRHR in tracking, analyzing, and preparing user-friendly communications for advocates around the world. Many of the people on this call, I think, will know her through the work in Euro mapping and Euro leverage. She was for many years the head of DSW here in Brussels, and for the organization as a whole later on. The other author of the study is Lou Compernol, who many of you will know from her years here at the Coalition. She has 15 years of professional work in the field of SRH and population and development, with additional expertise, obviously, from the Coalition and commodity security. And the third author is Sibylle Koenig. She's a development consultant and policy advisor with 10 years' experience managing, monitoring, and evaluating international aid programs and grant schemes, as well as advocates. She's worked for a variety of organizations, including the European Commission, the UN, and bilateral aid agencies. And so I guess with that introduction, I'd like to turn it over, the discussion over to Karen. Will you be taking it from here?
Absolutely. Thank you, John. Thank you for this opportunity to do this work. Thank you for the support in pulling together the webinar, and thank you for the introductions. That's very helpful. Much appreciated. Sibylle, would you like to move the slide ahead? Just, I'm going to start by giving you, as you can see, this is an outline of the webinar as a whole. We're covering a lot of territory in a very short period of time, which means that a lot of the messages that we're summarizing from the analysis will be telegraphed and reduced to very simple, brief statements. So I urge you all, when the report comes out, to read it closely, and particularly in the areas of special interest to you, because we simply cannot cover all the nuances that are necessary in the time available. So I'm going to start by just briefly going over the study approach and methodology. Together, the three of us consultants, myself with Lou Compernol and Sibylle Koenig, will be going through the analysis itself and the key recommendations. When we've concluded the main findings of the analysis itself, Sibylle Koenig is going to give a hint in terms of an advocacy mapping that's been prepared for very concrete action follow-up. Alison Marshall from IPPF has very kindly agreed after that to talk a little bit about the way forward with the IPPF advocacy campaign that will build on these messages. And I'd like you all, if you could, keep track of your questions during the presentations. There's a box on the right of your screen where you can submit questions, and then we'll take the question and answers at the very end of the whole session so that we can cover all the ground that we need to cover. Okay, next slide. Okay. So to provide a little context for the analysis, the international discussion on financing for development and the effort by donors to coordinate financing for development really began in 2002 in Monterey. And many of the issues that are being discussed this year are the culmination of a long-term process of analysis, review, refinement, and so on. Having said that, this year, in July, in Addis Ababa, there will be the third International Financing for Development Conference that is coming at a crucial moment. It's following on with the decision-making around the new SDG framework and the conclusion of the MDG framework. And it really outlines the decisions that are going to be made in July are going to be very important for funding flows and financing for reproductive health supplies, and of course for sustainable development as a whole for the coming 15 to 20 years. The trends that are kicked off by what's agreed in Addis will be important for the long term. So in preparing this rapid assessment, we really began by trying to understand what is known with some degree of certainty about reproductive health supplies financing now in the different categories that are important for the framework of financing for development discourse. I'll briefly touch on that, but again, when it comes to the questions of what data is available and the caveats around that, it's a very complex and involved discussion, so you're going to need to look at the report for all the ins and outs of that. So the first part of our analysis is really looking at reproductive health supplies financing that exists and trends and the knowledge about that. The second part was analyzing the financing for development documents that had been prepared. Starting last fall, an intergovernmental committee began preparing a series and publishing a series of reports that provide some insight into the thinking process leading up to the development of the outcome document that will be agreed in Addis in July. In March, an actual first draft outcome document was released, and from this, the three of us very carefully went through all the language and picked out 10 key areas where it's pretty clear that reproductive health supplies champions can and or should engage to influence the discussion of financing for development as a whole, to position reproductive health supplies financing in a good place post-July. The ins and outs of this we're about to go through, but let me start by leaving you with three main takeaway points that came out of a total synthesis of our analysis. First of all, the data that's available right now about where financing is coming from and going to for reproductive health supplies is wholly inadequate for the task at hand, and much greater investments need to be made in the basic research and policy analysis to know whether the changes that are taking place are having good effect or adverse effects. Secondly, there are two parts to the advocacy that need to spin out from this analysis. One is the immediate urgent advocacy that will take place on the specific language of the outcome document that will be agreed in July. And that requires quite nitty-gritty influencing the decision makers around wording for this outcome document. Having said that, the issues that are going to be agreed in July will be implemented over a longer-term basis by national donor and developing country decision makers and subnational level decision makers on an ongoing basis. So the need for longer-term advocacy and better engagement of reproductive health supplies community in these financing for development discussions, while they are abstract and really quite difficult to connect with, it's really important that we're able to, across the world over the coming years, engage in a longer-term advocacy effort on that. So again, there's one last point I'd like to give you as a takeaway, and that is one of the main areas of the financing for development discourse right now. It's a big trend, and it's a big area that's extremely challenging, I think, for many reproductive health supplies champions, and that is there will be a lot of support for new financing instruments that are complex, that involve blending public and private funds, that include increasing private commercial investment in sustainable development, that include using public ODA and public government funds for stimulating and supporting that private commercial investment, and also there will be an increased involvement of international financing institutions, development banks, around loan financing of sustainable development. And that's a major coming trend that we're going to need a lot of work as a community to be more conversant in. Next slide. Lou, would you like to briefly talk about the methodology?
Yes, definitely. We've worked for the past month and a half in a race against time and managed to consult over 157 sources and analyze them. And we consulted 30 experts from a wide variety of background, ranging from NGOs to academia and the private and public sectors. And we also actively participated in at least 4 online forums. And I'm not going to go into the details of all the resources that we analyzed. The slide, I think, speaks pretty much for itself. But what I did want to say is that the diverse information is a clear indicator that the data and information are very much spread out and have not been consolidated to date. And finding and piecing together the pieces of this complex puzzle and making sense of it was sometimes challenging, but I hope that in the slides that are coming up well, we will be able to shine some light on the issue. Thanks.
Okay, this next slide I'm going to talk only very briefly about because the complexities of the illustration you're about to see go beyond the time we have available. But you can think, in terms of thinking about what do we know about reproductive health supplies financing currently, you can think of it as an inverted pyramid of data in a way. The best, most comprehensive and clearest source of information is the now discontinued UNFPA Needy Resource Flows project, which has been in place for decades. And this project studies financing trends for population assistance as a whole. That includes HIV/AIDS and sexually transmitted diseases, which are about 60% of population assistance, 65%, excuse me, of population assistance. It includes basic reproductive health services, which represents about 23% of population assistance. It includes family planning, where most of reproductive health supplies fall, at 9% of population assistance. And then the fourth major category within the ICPD costed package is funding for research, policy analysis, and support of governments in their public policy and their public program management. And that's financed at a level of about 3% of the overall ICPD package. Zooming in closer to what do we know about reproductive health supplies. By the way, the reason that information is important is because it covers most of the different categories of financing that are relevant in the context of the financing for development discourse. It includes estimates for all sources of financing except private commercial financing. That's not present in the UNFPA Needy analysis. Zooming in closer, we have information on funding for family planning. Again, that's mostly donor-reported information, and that is the place where most reproductive health supplies financing is reported. And zooming in even closer to try to figure out what's going on with reproductive health supplies, we have two sources of information. The main source of information is donor-reported information on various international databases, and also information that's gleaned from studies that are designed for specific purposes. I'm going to stop with that. But to say that for many of the overall trends, because we're piecing together information from a lot of different places, we really have to make an educated guess about the trends for reproductive health supplies financing. Okay. This pie chart is derived from data in the UNFPA Needy Resource Tracking Project analysis, and the main point here, as you can see, is that actually consumers in developing countries out of pocket provide the greatest source of funding, of financing for the ICPD costed package at 64%. The next largest block of financing for population assistance as a whole is then developing country governments. And lastly, we have donor country governments. The other financing flows that are illustrated here provide a pretty insignificant amount in the picture as a whole. Next slide. Given what we're able to figure out about what we know about reproductive health supplies financing, it looks like financing for reproductive health supplies, family planning, and ICPD, the trends more or less mirror those for development cooperation overall in the 5 major categories of financing that are the structure for the discussion in financing among financing for development decision makers. And those categories are domestic public financing, which is developing country government funding, domestic private, which includes companies, nonprofits, NGOs, and individuals who are not public entities, their financing, international public, which is mostly donor government financing, international private, which is again companies, nonprofits, NGOs, philanthropies, and private individuals, and the last category is blended public-private financing. Next slide. Out of the 10 key issues that we've picked out from the Financing for Development document so far, the first of these Sibylla will talk about?
Yes, so the first issue we looked at is actually the definition of ODA. When we look at the zero draft of the outcome document, it clearly states and reaffirms the need for compliance with the 0.7% of GNI ODA target that we all know from the Monterey Consensus, which is a good thing. But of course, it means, I mean, we could have potentially increased funding for RH supplies. But there is also a risk here because the OECD is at the moment looking at expanding the definition of ODA to include new sectors such as, for example, climate security, which could create a greater competition for RHS funding. So our recommendation on these points are quite straightforward. We would like to support the existing Monterey ODA target of 0.7% to be kept for current RHA supply funding purposes. There are definitions already that have been agreed upon during the last years with regard to the level of funding channels to be channeled to health and to population assistance. For example, recommendations made by the WHO, but also which came out of the IPSI conference on how much should be channeled to health and ODA, and these definitions should be kept for the current commitments. If we're talking about expanding the definition of ODA, if we're talking about adding new sectors like climate and security, there should be new funds for these sectors which are additional to ODA. So moving on to the second issue now.
Okay. The second issue is one of two. Many of these issues are quite complex. But the second issue is quite new for many of us and very complex. Sibylla, can you move forward a little bit with the text?
Yeah.
Thank you. So the issue is that increasingly, as I mentioned before, ODA will be used to leverage, which is a code word that means that, among other things, increasing commercial investment, often through very complex new instruments. The opportunity for reproductive health supplies is the hope that we can, and that governments can, through their leveraging efforts, increase private sector resources for reproductive health supplies. And there is quite some hope there. A lot of women around the world today rely on the private sector to be able to access their family planning and reproductive health supplies. So it's not an unknown entity for the women around the world. It's not an unknown issue for the women around the world, but from a reproductive health supplies perspective globally, it's been under-measured, shall we say. The risk, on the other hand, is that when it comes to using public money for private commercial interests, there's a risk in the balance of where the money is going and who's benefiting from the money, and whether the investment is cost-effective relative to other possible investments where there's less moral hazard. Forgive the use of the term moral hazard. It is a technical term, and it basically means that when an entity receives funding to achieve something but is insulated, is protected against the downside of what happens with their use of that money. And the challenge really for us as a community is to find ways to get better information, to research and assess the value of these new instruments, these blended financial instruments and these new commercial investments, to fairly assess the value of them and the contribution they make to reproductive health supplies. Our recommendations in this report, some of which parallel those of other civil society groups that are more engaged in development finance but not so interested in reproductive health supplies, include that public money for commercial activities should really be contingent on a transparent and accountable governance framework to make sure that the private commercial activities respond to public values and public aims and address public aims. The second recommendation, again, as I mentioned, we need more research funding in order to assess the relative cost effectiveness of these new instruments and these new investments compared to what we know about other forms of investment. And finally, that reproductive health supplies champions, sexual reproductive health and rights champions, as a community, we really must improve our literacy on these issues and our ability to engage on these complex new funding instruments. The next key issue is also complex, and I'm going to have to be highly reductionist here. But in general, the financing for development documents released to date demonstrate a very clear interest in increasing both commercial loans and grant-like loans from international financing institutions and development banks to increase the resources that are available for sustainable development. The risk involved with increasing loans, there are several risks, but there are two really, a special one that I'll highlight here, and that is that many reproductive health supplies costs and family planning costs are recurrent costs. They have to be paid every year. New supplies have to be purchased every year, new service provision, new inserts, new information needs to be made available every year. So for developing countries that are trying to improve access, this is an investment that has to be made year on year on year. In general, public sector financial management principles argue that these are not the sort of costs that should be financed through loans, because when you do that, you're just piling up additional costs, the cost of the loan, on top of your regularly recurring annual costs. So in general, there is a significant risk that these sorts of loans, if they increase within the context of the ICPD cost package and reproductive health supplies specifically, will increase countries' overall financial burden and make it more difficult to improve access to reproductive health supplies. The opportunity is that, as the Pledge Guarantee for Health Initiative and others have pointed out, there are circumstances in which loans issued with under very strict criteria can help bridge financing gaps between, for example, a donor's funding commitment and their disbursement. So there are instances when loans can be helpful. Those instances tend to be quite narrowly circumscribed, and we need to be sure that development banks, including the World Bank, which is to be a major implementer of the Global Finance Facility for Every Woman, Every Child, that they adhere to transparent and clear criteria for the use of loans when it comes to reproductive health supplies and family planning and the ongoing recurrent costs of the ICPD cost package. So recommendations for this issue follow pretty naturally. Number one, we all need to work and to pressure decision makers to ensure that development banks and international financial institutions increase and improve their transparency on the criteria they make to issue loans, and also on their reporting of how the effects that the loans are having. The criteria themselves need to be super clear, and we need to ensure that donor grant funding continues to assure reproductive health supplies for impoverished populations in middle-income countries, for people in low-income countries, and least developed countries especially. Lou?
Yeah. The importance of ICPD financing for sustainable development. As we all know, the ICPD program of action is central to our field and our work. And the Zero draft actually calls out programs of action previously agreed to by the UN. What it does not do is call out the ICPD specifically, no doubt because the drafters are not aware of its existence, let alone the importance. While it does connect to really critical issues that are very much featured in the FFD documents, like environment, consumption patterns, gender, and equity. So we have a really good case to make. What this issue highlights, or has highlighted for us, is really the potential of being informed about these financing issues and the ability to insert key messages. And while we were undertaking this research a couple of weeks ago, we managed to slot this ICPD language in a key text that was then submitted by the global civil society group that is providing official input into the zero draft. The recommendations are definitely to continue plugging the ICPD language and ICPD concept into these documents, and also continue to advocate for a fully funded ICPD package, which was a commitment that was made years ago, but also importantly to maybe use regional forums better, like NEPAD, that were set up to track MDGs, that are now being set up to track the SDGs probably, and use those more effectively. Yeah, next slide. On guaranteed social protection, essential public services, and universal access, the zero draft actually calls out the support to a social compact to guarantee minimum levels of social protection and essential public services. And they also talk about including access to essential health care. This really spells well for SRHR and reproductive health supplies, but we still need to make a better case for SRHR and as a public good, mostly because of obviously the externalities that represent in terms of the environment, in terms of the demographic transition, and the benefits that they accrue for the community at large. And at least they should really be a key component of any essential package at the national level, just because of the tremendous return on investment investing in reproductive health represents. In addition, out-of-pocket spending, as Karen has already mentioned, represents a huge burden for lower income countries, with an estimated 64% of financial flows for the ICPD services, information and supplies being carried by users themselves. That is why social protection issues and risk pooling is no doubt a recurrent theme in both the GFF and FFD documents. And although we obviously welcome social protection, we are also a little bit hesitant to completely put our weight behind issues like risk pooling, and really urge the community to look at ways that we can ensure that the poorest and most vulnerable populations have access and continue to improve their health. And lastly, as always, the international community does not shy away from making commitments at the international level. And we also need to make sure that commitments made in the past are actually kept. And urge countries to fulfill them.
Okay, so the next issue is the 6th out of 10. So we're halfway through the key issues we've pulled out, and this issue has to do with the use of global funds. There is some clear interest in the documents of produced by the Intergovernmental Committee working on these issues, there's some clear interest in exploring whether a global fund or global funds should be responsible for managing this new social compact that Lou was just talking about. The opportunity there for reproductive health supplies specifically is that, study after study has shown that there are a number of cost efficiencies and effective approaches that result from having global and multilateral funds such as UNFPA and USAID help countries with their procurement processes, help them negotiate better prices because of large global volumes, and helping with the management processes as well. There are risks as well. And one risk that is raised by many civil society organizations that as a community we can think about, because it's a complicated one for us, but there is some concern by some leading civil society groups that global funds in general undermine the ability of developing country governments to drive their own development processes. And that's something for us to think about, because certainly advocacy for the ICPD package at the national level in many countries has been very difficult when there's been increased national government driving of development priorities. So it's something we need to work on and think about and assess as a community. The second issue there in terms of risks is that when it comes to global funds, there is a serious challenge around transparency and accountability. When you look at the information that has been released by the Global Financing Facility for Every Woman, Every Child, for example, much of the information that's been made available, although they have tried to include civil society, but much of the information that's been made broadly available does not clearly and in a detailed, transparent, and reliable way explain the assumptions that are going behind the business planning. And the Reproductive Health Supplies Coalition has a group that has been focused specifically on engaging with the Global Financing Facility, and that certainly is an important effort to keep up, because global funds will likely continue to be an important part of financing for development in the future. In terms of our recommendations, yeah, thanks. We recommend that there be continued global and multilateral fund assistance for reproductive health supplies procurement at the country level. Many countries are in periods of transition on that, where they would like to transition ultimately, some of them, to being fully in charge of procuring and managing the reproductive health supplies chain without the assistance of international actors. But in the meantime, many of them need assistance, continued assistance for cost efficiency. Our second recommendation is that, I think I addressed this already, actually the developing countries' own capacities to cost-effectively manage reproductive health supplies procurement varies dramatically. In countries, the evidence shows that in countries where there's been increased decentralization of government responsibilities, that the challenges multiply exponentially, including in terms of procurement of quality supplies. So that's something that is going to require vigilance, and then vigilance is also required in monitoring of global funds, as I've addressed. The next issue has to do with a clear intent and desire expressed by the Financing for Development decision-making to increase domestic revenues, domestic government revenues, their tax financing of public services, and especially when it comes to health and education and social sectors. So that we think that that has already been a trend within reproductive health supplies, although the evidence is not completely clear about that, but we do think that that has been a trend. And the opportunity there is that if there is increased domestic developing country government for reproductive health supplies, in theory that increases the resources that are available as a whole and increases access. The risk is a very complex one and really merits more analysis and teasing out of the nuances than we have been able to do so far, honestly. We've heard about how consumers are paying out of pocket most of the ICPD costed package. Consumers in developing countries are also on the whole, paying a lot more out of pocket for their ICPD-related services, information, and supplies than consumers in wealthy countries. So what's important is that efforts to increase domestic revenue, domestic tax revenue, does not reduce their ability to purchase needed reproductive health supplies, which would argue for progressive tax rates, progressive tax increases, progressive by income. People who have more should pay more. And you can make an argument that out-of-pocket spending for reproductive health supplies and other essential services should be tax-exempt or tax-deductible. I will just mention one point because it's important to keep in mind. If domestic revenue is increasing through taxes, and as a result of that, domestic government funding of essential public services like reproductive health supplies also goes up. There may be a compensating factor. So again, these issues are quite complex and much more merit much more analysis than we've been able to do so far. Next.
Right. Yeah, so the next issue we looked at was actually something very positive that is mentioned in the Zero draft, which is the importance of women's participation, full participation in the labor market, which led us to say, of course, as an RHS community, we should be advocating for the fact that women's ability to make informed family planning choices is a sort of precondition for their full participation in the labor market. Fortunately, we actually have a lot of the buy-in from actually the CSO groups who participated in the Financing for Development drafting exercises, including also the Women's Working Group for this recommendation. And so much so they actually included a recommendation on this point in their consolidated CSO input to the draft. So the recommendation, very simple. We should be continuing to ally with these groups and to make sure that the final outcome document indeed makes the link between gender equality, women's labor market participation, and RH supplies. Now moving on to a slightly more complicated issue, devolved decision making. So the Zero draft also acknowledges that there's a tendency of developing countries towards increased decentralization of decision-making processes to subnational levels. But often this is happening without providing actually subnational levels with the adequate, capacity building needed to take over these decision-making processes. This is, it could be an opportunity for instance, for the management of RH supply chains, if, like, within these processes, subnational levels actually acquire the needed capacities and abilities to manage the supply chains. This could lead to, greater accountability and, more involvement at levels that you want to be which you want to be involved in these processes. However, the challenge is, of course, that these capacities are lacking, as mentioned, but also some studies have shown that at subnational level, there's some disadvantages with regard to, for instance, the purchases of reproductive health supplies, which cannot be purchased in bulk, so therefore it's a more costly process. Sometimes there is more corruption at these levels, there's less control, family planning is not prioritized. Sometimes the commodities that are purchased are of lesser quality because of a cost issue. So there are issues also related to decentralization here. Now, our recommendation on this would be that if we're talking about decentralization and if we're going towards that, it's a good trend, but it needs to be done gradually. Perhaps in the medium term by keeping some decisions at the national level, but while simultaneously strengthening the capacities for managing our RH supply chains at subnational levels. Moreover, the CSO should be strengthened in order to facilitate community participation and accountability within these processes. And last but not least, funding should be made available for better data collection, analysis, and monitoring of financial resources available for RH supplies at both national and subnational levels.
Okay, thank you. So the last of the 10 issues by now we've touched on quite a bit, but fortunately the financing for development decision makers themselves also recognize the importance of this. They have an entire section in their zero draft outcome document focused on the need to strengthen data collection, monitoring, and transparency to see what happens with financing trends, to know what's happening now. The challenge, so that's an opportunity for us. You know, there's an opportunity if there's more interest by government decision makers to support that, then we have the opportunity to insert reproductive health supplies data needs into those efforts. The challenges, of course, are that, as has been mentioned, are the data that we need in terms of understanding what's really going on with reproductive health supplies financing. The data needs are overwhelming. And of course, the financing for development decision makers as a whole don't generally know much about or have much motivation to focus on the data needs in relation to reproductive health supplies. So that's our job, is to make them aware of the importance of that for sustainable development to be successful. Our recommendations are that there be an international panel established that can really look at these issues in detail and propose ways to overcome the data challenges, to fund research, to fill the gaps in information. Our second recommendation is, of course, that governments worldwide improve their data collection and transparency efforts. This is especially true when it comes to international financing facilities. The financing for development decision makers themselves complain, in essence, about the lack of progress by IFIs, by international financing institutions, by development banks, and so on, to improve their transparency and governance arrangements. There's significant criticism there. So that the last recommendation is that governments, between governments and among governments, there be compacts, agreements established that standardize the detailed reporting needs that we have within the ICPD costed package for sexual reproductive health and rights expenditures, for reproductive health supplies expenditures, for family planning expenditures, by financing source, per capita, and disaggregated with a wide variety of demographic data that many of you are aware we need in order to know whether access to reproductive health supplies is improving and whether the ICPD program of action is achieving its intended results. So to conclude, I'm going to repeat the 3 takeaway messages I mentioned at the beginning. The need for better data and research is immense. The reproductive health community needs to improve its knowledge and literacy on the new financing mechanisms specifically, and how to talk the talk within the financing for development world as a whole, especially when it comes to the new financing mechanisms that support private sector intervention, the blended financing mechanisms, the loans, because these are new to many of us and they are complex. And so for us to be credible in talking about them, we need to increase our knowledge about them. I hope this report begins to help that a little bit. And then the third key message, again, is that advocacy for reproductive health supplies language in the outcome document to be agreed in July in Addis is very urgent right now, but it will also require long-term engagement at the national and subnational level around the world to ensure quality, equity, and access and rights for the ICPD program of action. Next, Sibylla is going to give us an overview of the work that she's done. I mean, we've all done, but Sibylla really led on advocacy mapping to help guide some of the advocacy that's going to take place over the coming months.
Yes, thank you, Karen. I'm going to go away from this presentation and just show you an extract of the advocacy mapping, so that you can actually see what it looks like. So I hope it works. All right, it should show now. So the aim of this mapping, which complements the analysis, is to support nuanced advocacy interventions by providing an actionable framework on how to best take the report's messages forward in order to influence relevant players at key moments in the financing for development decision-making process. So you can see here the structure of the table, which is quite simple, but it's straightforward. You have 4 columns. You have timelines with a timeline with key events in the upcoming months. There are also some events that have already passed in the table. You can't see that here, but they are they've been put into the table so that you can see. You can put all the events in context and see what has happened since the beginning of the year. So here I've just taken an extract to show you what's happening right now and what's coming up very soon. You see an event, the Asia Pacific Regional High-Level Consultation on Financing for Development, which is happening right now, and then a few others that will happen on 1st of May and on 5th to 7th of May. You should use this table as a tool really to see, okay, what is the event here? There's always a hyperlink to the event. You can see the key stakeholders that we should be approaching as a community during those events. Then you can see how to register for the event, what key sessions to attend, what are the key questions that will be asked during the event, and what we should be thinking about, preferably ahead of our attendance, if possible. What will be the outcome if there's an outcome document of the event, and what are the actions or techniques for influencing that we could use during the event. There are different colors in this table that have been used, like light red is for those events that are linked to the main financing for development events leading up to ALICE. Then there's green for the post-2015 SDG process, and then blue for events that are generally interesting but are not related to these 2 main processes. So like, for instance, here there's a civil society event, the Eurodat conference. I don't want to go into much more details about it. It's really a tool to look at when you're trying to attend one of these events or looking at opportunities for getting a foot in during the coming months. If you have any questions on this, you could let me know. Otherwise, I would like to pass on to Alison Marshall from IPVF, who will explain us a little bit in more detail what IPPF's campaign will look like during the next coming months.
Alison, are you able to speak? Helen, are you there? Can you help us with this?
Oh, hello, Alison here. Can you hear me?
Yes, welcome.
Fantastic. So first of all, thank you very much indeed for such a clear presentation, and it's really exciting to have such very, very helpful research. Great job. Second, thank you very much to the RHSC for agreeing to provide support to IPPF to try and take this fantastic research and make it widely available to RHSC members and others in civil society who can take action to influence this really important agenda. It's really exciting to know that we're going to be able to make sure that your research is really put into action. Because that's the essence of the project, is to take your recommendations and turn those into even clearer, because yours already is clear, but even clearer briefs and action alerts, and even help by drafting some template letters so that we can send those out far and wide, including to all RHSC members, so that we make it easy for people to take action to influence on the points that you've just been sharing with us. Because while your research is super clear, some civil society organisations have very limited staff time, and if we are able to provide them with a really easy action like a template letter, and we're already giving them the name of the person to send it to and the date by which they need to send it, we're going to help to generate more pressure for the changes that we want to see. So the project essentially is that it's about putting this research into action by putting easy actions out widely, and we also will make some small grants to organisations that are well positioned to influence but would be unable to take action unless they had some extra resources to help them. And we'll have very strict criteria for recipients of those small grants, and there won't be many because it's not a big pot of money, to make sure that those small grantees can really use the resources in the short time that is available, because as you've been saying, and we can see from your table, it's all happening right now, and the project has to be done by the end of this year. So the main focus will be to support people who can take action at the national level. So it's going to be about trying to influence national governments, national decision makers, but there could also be a bit of influencing to global level decision makers. For example, if it's the World Bank, we might be encouraging people to take an action whereby they contact the executive directors of the World Bank for their region. So really we hope that the project will start to help to address your recommendation number 2 that you just shared, which is to improve the knowledge and engagement of the reproductive health community on financing. Be delighted to take any questions or go into further details if that would help, but I think that's the essence of it.
Thank you, Alison. Thank you so much. And Lou has kindly agreed to be the traffic cop for questions and answers. Do you want to take over for that now, Lou?
Sorry, Karen, I was on mute. Yes, I've been following the questions and I've been answering them. I mean, the simple ones, I've been answering them as we were going along. There's just, these past minutes, there's been a flurry of questions coming in. There's especially been a couple from James Rosen, who has asked us what the trend time frame is.
What the trend time frame is, on what basis trends were determined?
Yeah.
If that's the question, what we did was we looked at where it was possible to do so. To some extent, the data trends, the time frame for them was determined by the nature of a specific study that was designed for a specific purpose. For example, the Clinton Health Access Initiative has done a study that had a defined time period. The RHSC has commissioned a number of different studies that have had defined time periods. But in terms of the primary data collection that we did through online databases such as the OECD DAC creditor reporting system, the Reproductive Health Interchange database, looking at the WHO Global Health Expenditures database, and any place we were able to have some control over that. We looked at the starting point a decade ago, and then the last 5 years of data to see what the trend was. So that showed, for example, if you go back a decade ago, or rather within the past 5 years, financing by donors for family planning has increased, whereas since the past 10, 15 years, financing for sexually transmitted diseases and HIV and AIDS within the ICPD cost package has been going up for the past 10 or more years. So the time frame in some cases was defined by studies that we were reviewing, and when we were defining the time frame, it was 10 years ago, and more specifically each of the last 5 years.
Great. Thanks, Karen. And there's actually a question, but I think that's actually more a question for Alison. So I don't know if we can unmute Alison again. There's been 2 questions on how we see this work coming together in the future, and especially how we will reach out, because obviously the lessons for the reproductive health supplies community, some of them can also be taken to other issues as well. And 2 questions were asked, how we will be engaging with the women's working group on some of our findings, and also how we will be reaching out to the broader family planning community. And, are you online, Alison?
Yes, I'm here.
Great.
Reaching out to the women's working group, it sounds as if we need to be building on the connections that you 3 researchers have already very helpfully made, and possibly there might even be a chance, I don't know, for you 3 researchers to give this presentation again to the women's working group, because they seem very important and key allies. In terms of reaching out to the family planning community, yes, we will make sure that the action alerts and the template letters and the briefings go as broadly as we can. So we'll be sharing them, for example, through the Advanced Family Planning Partners group as well, and we'll see what we can do through the FP 2020 group and through our Joining Voices colleagues across the world. So yes, the intention is to get it out as widely as we can using listservs and groups that we're all part of.
Great, thank you, Alison. There's also been 2 more statements from Albert Kalangwa and Halima Sharif that raise, and justly, concerns about out-of-pocket expenditure within poor countries, and the sort of the human rights issues attached to ensuring access for all. And a question sort of how developing countries can mobilize sufficient domestic resources to address this. And I don't know, Karen, whether you want to say something about the out-of-pocket spending and the domestic resource focus in the FFD.
Sure. What I can say is that in the FFD outcome documents, there are quite a few ways that, and I should say that the signatories to the outcome document in July will be heads of state from around the world. So both donor and developing country governments are participating in the development of the outcome document and in its agreement, and of course with its implementation as well. And in the draft outcome document itself, there are quite a few recommendations about how developing country governments can be assisted in their efforts to generate increased domestic resources for health and other essential services. A lot of them focus on topics that are, of course, of interest to reproductive health supplies, but not necessarily an exclusive focus of ours. So, for example, they focus on reducing corruption, on making sure that rich people in countries can't save their money outside the country's borders to avoid taxes. A lot of these sort of issues, as well as more the nitty-gritty of tax collection, finding people, making sure that citizens are registered, the nitty-gritty of administering tax collection efforts. This has not been a major focus of this report. The issue as a whole about the balance between raising funds, developing country governments, raising tax revenues, and spending general revenues for health has been highlighted because it merits more attention, and it could have a direct impact on consumers' out-of-pocket ability to buy their own reproductive health supplies or on their ability to access publicly financed reproductive health supplies. But most of the details in the outcome document about how governments are going to be assisted to strengthen their capacity to generate revenues are a bit afield from the nature of the work that most of the reproductive health supplies community is likely to be involved in.
Great, thank you, Karen. I just got another question coming in that was more about sharing the resources and the tools and the presentation. And I can answer that one, that we will be working together with the coalition to make this presentation and the tools publicly available as soon as possible. The report will probably be going through some final editing and formatting, but we will be talking to the coalition, and please watch the coalition space because we will be posting the resources on there as soon as possible. And I don't know if people have any more questions. We've gone through all of them. There's just, yeah.
Okay, well, if there are no more questions, I would really like to thank you all. We're honored to have such fantastic interest in this topic. We're thrilled about it. Obviously, the three of us who worked on this analysis and the RHSC who funded it, we care a lot about these issues, and so of course we think everyone should. So we're really thrilled at the very, very high response rate of interest to this webinar. Thank you for that. We urge you to read the full report when it comes out. I noticed there were some questions about some of the acronyms that were mentioned during the presentation, like what is ICPD and what is EWEC, and of course all of that is spelled out in the report as a whole. If you missed the explanation while we were talking, you can find more details there. And we hope that this webinar, the report, really instigates more interest and more activity to tease out the issues that we haven't been able to, and to act on those that we have. Thank you very much. I don't know, John, if you're still there, did you want to say any closing words? Because I think from our end, we're done.
Great. Okay, thank you. Can you hear me?
Yeah. Yes.
Okay. No, I'd just like to thank all of you for the really fascinating presentation. I had read an earlier draft, but I think this is certainly, I won't say a huge improvement on the last one, but I think many of the issues are certainly much clearer, and I think this will be incredibly useful to our community. So thank you very much. And thank everyone for having joined the call. As Karen said, I think we had something like 60 people on this call. So there's a lot of interest out there. And if people have any questions, please don't hesitate to get in touch with the coalition. So thank you very much.
Thank you.
Thank you.